Hi everybody, my name is Kaylee Lewis. I'm going to be talking to you about how the andragogical model directly relates to nursing as a profession. So the way we understand it, the andragogical model was first developed by Malcolm Knowles in the 1960s. Basically, it literally means man leading or adult learning. Pedagogy is the teaching of children, and andragogy follows up in those footsteps by going in the direction of adult learning. So this model had six assumptions, and four of them were original, two were added later. But basically, they all just describe important elements of learning for the typical adult, and those would be things like self-concept, adult life experience, readiness of the adult learner, change in time perspective, internal and external motivations for learning, and reasoning for learning. All of these things can certainly relate to nursing as a profession, because in nursing we are teaching not only patients, but we're teaching future nurses, and we're also teaching ourselves at all times. We as nurses have to learn to be safe and competent nurses, and when we do that, we're safe and competent to take care of patients 100% of the time. So as we teach ourselves, the saying goes, teaching is the highest form of learning. So when we're teaching patients, we're also kind of reiterating what we've already learned. So the way that this relates to the profession also is that we have something called evidence-based practice, and that's basically just all compiled research by nursing researchers and data that's been found in studies that have been performed, and that all relates back to our nursing practice as a whole. So critical analysis of effectiveness, basically in the nursing profession, we would look at these things as six separate evaluations or six separate assumptions, just like they are in the model. Like for self-concept, you would introduce a concept to a patient or like to a nursing student and just kind of let them run with it. When I was in nursing school, we used something called a self-taught classroom, and it was very effective. We did peer-taught learning experiences. Like for life experience, you might use the example of like a labor and delivery nurse like myself might use the fact that they've already delivered a baby as a good motivation for a laboring mom to want to learn something. Readiness to learn. Does the adult that you're teaching feel important in some way, or do they feel like they don't really have a function in society? If they don't feel important, they're not going to have a motivation to learn. Adults feel this kind of urgency most of the time to learn and apply things, which has to do with the change in perspective of time. So if adults, or in my case, patients or nursing students, feel this urgency to learn, then they'll use whatever they're learning and apply it to whatever stage they're in, say, for example, Erickson's developmental theory, which just kind of addresses all of these different stages that people go through from infancy all the way to being elderly. Do we really know why we want to learn? A lot of adults don't really care why. I'm one of those adults. That's never really been important to me, but there are a lot of adults like my mother that always ask the question, why? Why do we do this way? Why is it important for me to know this? Just things like that. And then also internal and external motivation. Is it more important for the adult you're learning or you're teaching internally? Is it more important for them, or are there extrinsic factors like patient care or going home and having to take care of a sick family member, things like that, that are causing them to need to learn the things that they're learning? Some good ways to evaluate effectiveness would be like giving a certification exam, for example, for a nurse that has learned a course in like cardiopulmonary resuscitation. or fetal heart monitoring, things like that. So passing your certification exam is a good indicator that you've retained the knowledge that you were taught. For patients, it may be like a return demonstration, like me showing mom how to change a diaper and then her showing me how to change the baby's next dirty diaper. So just things like that are good ways to know how the androgogical model relates to nursing as a profession. So I hope you found this helpful, and if you have any questions, feel free to comment and let me know. Thanks.